What is the blood pressure range for hypertension?
When we have a blood pressure reading, it consists of two numbers. The first top number, called systolic blood pressure, means the pressure in arteries when the heart beats. The second bottom number, called diastolic blood pressure, measures the pressure in arteries when the heart rests between beats. When the blood pressure reading is in the range of 130-139/80-89 mmHg, we may call it to stage 1 hypertension. When the blood pressure reading is 140/90 mmHg or higher, we may call it to stage 2 hypertension. When the blood pressure reading is 180/120 mmHg or higher, patients need to visit the hospital emergency room, ER, as soon as possible since it is the situation of hypertensive crisis.
Why do patients with diabetes tend to have hypertension?
High glucose levels in the blood can glycate collagen in the blood vessel walls and stiffen the collagen in the blood vessel walls, which leads to high blood pressure. Consistently high blood pressure can damage kidney glomeruli. The damaged kidney cannot regulate blood pressure anymore, which may lead to high blood pressure. The high glucose level in the blood can increase the formation of advanced glycation end products, AGEs. The AGEs can induce inflammation response in many cell types including macrophages, endothelial cells, and neurons. Patients with diabetes tend to have obesity, which is highly linked to inflammation. Endothelial inflammation can cause the blood vessels to be narrow and stiff, called vasoconstriction. It stimulates the production of vascular smooth muscle cells which make the blood vessel to be thick and stiff. And, it also forms plaques in the blood vessel. Altogether, endothelial inflammation induces high blood pressure.
Thank you for your detailed explanation. Is there any way to reduce blood pressure for patients with type 2 diabetes?
Yes, patients with hypertension may have multiple options to reduce blood pressure. As I told you, in the situation of a hypertensive emergency, patients need to visit ER as soon as possible. Patients with hypertension may visit doctors to get hypertension medications. There are multiple groups of hypertension medications, for example, beta blockers, ACE inhibitors, and so on.
Thank you for the information. Is it always okay to rely on hypertension medicines for patients with type 2 diabetes?
In our discussion, we know the cause of hypertension, which is type 2 diabetes. It would be better to try to cure type 2 diabetes instead of suppressing hypertension with drugs for a long time.
I agree. Are there other helpful ways to reduce blood pressure while patients try to cure type 2 diabetes?
Yes, exercise is one of the options to reduce blood pressure. However, it would be a good idea to check with a healthcare provider for patients with type 2 diabetes. Regular exercise with low-impact movements may be helpful for patients with type 2 diabetes and high blood pressure, for example, stretching, walking, bicycling, gardening, and yoga. People with joint pain may choose joint-friendly exercise options such as bicycling, swimming, and water aerobics.
I knew that exercise has been generally recommended for patients with type 2 diabetes and hypertension. But starting a new exercise program is not easy for some older adults.
It is still okay for them to try regular exercise with low-impact activity including stretching, walking, gardening, swimming, and yoga. When it is not easy to do regular exercise, controlling diet would be helpful.
Oh, what kinds of diet would be helpful for patients with type 2 diabetes and hypertension?
This is one of the important questions to improve the life quality of patients with type 2 diabetes and hypertension. Low-calorie diets and low-carbohydrate diets have been discussed in these cases. Nitrate-rich foods may be helpful for patients with high blood pressure to reduce blood pressure.
Nitrate-rich foods?
Yes, nitrates in nitrate-rich foods can be converted into nitrites in the tongue or saliva. The nitrites can be converted into nitric oxide by nitrite reductase in the stomach. Nitric oxide induces the relaxation of smooth muscle in the blood vessels. Nitrate-rich vegetables include green leafy vegetables, beetroot, and radishes. Fruits containing nitrates include watermelon, apples, and banana.
Thank you for the helpful information. If this video is also helpful for viewers, I would like to ask them to subscribe here and watch other related videos. Thank you again. See you soon.